Hello, and thank you for tuning in. I appreciate Gilda's Club asking me to come and speak about what is palliative care. My name's Andrea Lantz, licensed clinical social worker, and I have a history of working in palliative care and hospice. So who are these palliative care people? Well, depending on where you live, the palliative care program services may vary. Palliative care is provided in a variety of settings, including hospitals, outpatient clinics, as well as residential homes and in nursing facilities. Providers may include nurses, physicians, nurse practitioners, chaplains, volunteers, social workers, and other mental health providers. Their training and expertise and experience varies from different board certifications as well. And some programs charge for fees, whether that be billing insurances, which most cover, including Medicare and private insurances and Medicaid. And some programs are free to the public, typically through donations, and meaning they are not fee-for-service based and are usually valued and invested by a larger health system. And so what illnesses do palliative care cover? What makes you qualify for services? And for those that are connected with Gilda's Club, we know that cancer certainly is one of the diagnoses, however, it includes much more. Palliative care supports people that are living with chronic health conditions that are not curable. This may include heart, lung, kidney, and other neurological diseases such as dementia and other forms of Alzheimer's as well. Having said that, that also includes strokes, multiple sclerosis, Parkinson's, HIV, and more. Unfortunately, many people don't understand the difference between palliative care and hospice. And unfortunately, people pair them together and don't understand them separate and alone as is. Even if you aren't sick, are not dying, or aren't feeling overwhelmed, palliative care sometimes can still be of support. Some people are fortunate where they don't need the expertise symptom management of palliative care. However, some benefit from needed acknowledgement of and relief of the actual symptoms that they're dealing with and sometimes are not talking to someone about. That may include nausea, constipation, loss of appetite, fatigue, shortness of breath, and pain. We know that palliative care and/or hospice can help people much sooner, and I want to describe a brief difference between the two. I'm a visual person, so if you have a large circle, imagine that is palliative care. It's all about quality of life. Palliative care supports people no matter their age, their diagnosis, and where they're at in the disease process, focusing on quality of life, regardless of their treatment plan. Hospice is a small bubble within that bubble. And the big difference is that it's for someone that may have less than 6 months to live, according to their medical providers, if they allow their natural disease to run its course, meaning not trying to artificially intervene with medications or disease-prolonging treatment. Both hospice and palliative care want to improve your quality of life. With palliative care, you can receive those services alongside the treatment of curative or disease-prolonging treatment. The goal is quality of life, and what that means to you and your family as your disease changes and impacts your life. And having been a medical social worker and a certified advanced care planning facilitator, I believe it's really hard to provide the best care for someone without having an in-depth advanced care planning conversation. And having said that, it's important that we explore people's personal preferences, their values, what quality of life means to them, and what gives meaning to life as their disease changes. Because once these conversations are had, we can then place them into a written document called an advance directive. Palliative care also communicates with your other medical providers and your oncologist as needed. They assist with providing disease education and coordination of care to best meet your needs while living with that disease. They typically don't manage or take over your care, but they're that extra layer of support and expertise. And I've always found it bittersweet to have knowledge in advance. For those that are living or supporting someone with cancer, it's bitter for the obvious reasons. However, the sweet part is that we do have the opportunity to know, do, learn, and say things otherwise. That's why earlier discussions are so important, and it can reduce unnecessary stress, grief, burden, or complicated grief. And so please note that all programs vary, and where they provide services, who provides services, how often they can see you, if they are able to prescribe drugs and medications, as well as their location and including telehealth services as well. So there's a great website if you or a loved one are interested in learning more about palliative care to find out if you might meet criteria and where services are in your area. Go to www.getpalliativecare.org. And palliative care is PALLIATIVE.org. Another great free resource for advanced care planning is prepareforyourcare.org, where you can watch short videos to help learn ways to have conversations, and you can complete a free advance directive that is recognized in every state here. If you have any more questions about palliative care or advanced care planning, please don't hesitate to contact me at Lantz Counseling, Consulting, and More. You can email me at lantzccm@gmail.com. Thanks again, Gildas.